Stan, thank you very much for speaking with us. So tell us, you've been looking at the global economic landscape, and you're a company that's present in many countries, as I understand, almost 25 countries. How do things look from a healthcare point of view? So where's the sort of demand supply pressure points, if one may call it that?
Well, Govind, first of all, the world economy is moving in a positive direction. There's no question that the US is growing, not as fast as we want. I'm not as down on Europe as many others are. I think the economy is doing better, and I think Asia is also doing better. The developing world is doing much better, perhaps not as fast as people want. So what we're looking for is political stability. There's a lot of potential challenges around the world. We'd like to see stability. With that, the world economy could continue to grow. Now, from a healthcare point of view, the issue is we need to move from healthcare, from a system that is actually sick care, that takes care of you when you're sick, to healthcare, which involves prevention, which involves wellness programs, and dealing with the NCDs, the non-communicable diseases. We need to try to stop people from getting sick rather than treat them when they're sick. We need to have much more activity taking place outside of the hospital.
Right. And any suggestions or thoughts on how this could be attempted? It is being done. It's not that it's not being done. And where could it be piloted, so to speak?
Well, it's being taken place already in many places of the world. But we need
the manner in which you feel it should be done.
We need different kinds of models for healthcare payment. Today, we pay a premium, and we pay doctors for taking care of people that are sick. We need to find methodologies to prevent people from getting sick. So doctors should be encouraged to keep people healthy. Outcomes are more important than how many procedures we do. There should be reimbursement to keep people out of the hospital and not take care of people in the hospital only.
Right.
So we need to change the model of healthcare, and we need far more telemedicine, and that's very much applicable in India, where there's an opportunity. You have high tech, but there's an opportunity to take care of people in the community rather than have to come to a hospital.
Right, so, but that also sounds quite dramatic and utterly transformational, right? If you were saying that can I pay a doctor so that I don't have to see him?
Yes.
Effectively.
Exactly right.
So who's going to bell the cat?
Well, it's starting to happen because we need to change the reimbursement from a fee for a service to a capitation program. You have 100 patients or 100 people in your population, this is how much you get. And the goal is to keep people healthy, and there needs to be qualitative outcome testing. And we're seeing it in a number of parts of the world. There are a number of, in the US and other parts of the world, there are a number of providers of services that are already getting reimbursed based on prevention and outcome.
Right. And how do you see the near future when it comes to the kind of health-related services that are being consumed and being offered I mean, in different parts of the world?
Well, the key is we have great technology out there. Digitalization of healthcare is right there. The technology exists. The technology exists to, for example, have an X-ray digitally taken in America and have it read by an Indian physician. The cost is less. There's an opportunity to go into the most remote communities in India and take somebody's blood pressure or monitor their glucose level and treat it remotely. These technologies exist. We just got to get them out.
Right.
And the model for payment doesn't exist. But it will change.
Right. So, I mean, as the world progresses towards wearable technology and real-time monitoring and apps and so on, how are you as a company gearing up with that world?
Well, we are very much investing in the area of digitalization of healthcare. So, for example, we're the largest provider of dental products. Today, instead of getting an impression with impression materials, you can have a scan taken. You could send that scan chair-side through a computer, and right there and then, within 1 hour, get a crown or a bridge milled. Just there. It's convenient, the cost is low. This is the kind of activity that's going to take place throughout the world, reducing the cost and improving the quality of healthcare. It exists In X-ray, for example, you don't need those tanks to develop anymore. It can all be done digitally. It can all be sent into a computer record where all your information is available, and this is for pennies.
Right. And are there things that I will be able to do myself in order to even go to, in order to prevent that visit?
Yes. When in 10 years' time, you will not have to go, assuming healthcare systems reimburse, but you will not have to go to the doctor to have your blood pressure checked or your blood checked. This can all be done at home, conveniently, and not disruptive, and the doctor will only deal with you on exceptions.
Right. And this also sounds like you're killing your own business model.
Well, yes, we're changing the model. It's not. The 20th century was about buildings and products. The 21st century is about technology.
Stanley Bergman, thank you very much for speaking with us.
Thank you very much.